I'm Dr. Sasikanth, Senior Consultant Plastic Cosmetic Surgeon. How do we reconstruct the fingertip? So fingertips, generally, the reconstruction of fingertip, especially the palmar skin or thick skin of the fingertip is very important, and it should be reconstructed with the similar skin, because that similar skin will give the thickness, the softness and the tactile sensation and the firmness with which the grip is restored. So these things should be matched. So it should always be reconstructed with the same skin. So what are the different methods that we use to reconstruct the fingertip? So there are many small flaps, what we call small flaps, which we use from the adjacent normal skin, from where that flap will be raised and advanced into the defect. These are called advancement flaps. So it's called a VY advancement flap. That VY advancement flap can be taken from the side of the fingertip or finger, or the proximal finger, or the finger which is proximal to the defect or proximal to the injury. From there we lift the skin in a V fashion and we push it up or advance it into the defect and close it in a Y fashion. So these are called VY advancement flaps. But there is certain limitation to the size of the defect, which can be closed by this VY advancement flap. So if the defect size is more and the VY advancement flap is insufficient for closing the defect, we use a flap called thinner flap or sometimes hypothinner flap. So these are fingertip injuries where we keep the finger, we take a small skin flap from the palmar skin, especially on the base of the thumb. These are called thinner eminence. This is called thinner eminence. So we raise a skin flap on the thinner eminence, and from there you keep this finger, the tip, either index finger or middle finger, whichever the fingertip is lost, we keep this finger, bury this finger into this thinner flap, this one, and we suture the flap with the defect on three sides of the defect, leaving the one side open. So this finger, this thinner flap, we keep this finger in this position with plasters, and we anchor it with plasters and keep the finger like that for 3 weeks. And after 3 weeks, what we do is remaining part of the flap, that is the fourth side of the flap, and free the finger. So in that way, the skin from the thinner eminence or the base of the thumb is transferred to the fingertip. And in these 3 weeks, this three sides of the fingertip, the flap will get united with the rest of the fingertip, and the blood supply will be restored from the three sides of the finger. And the fourth side, when we remove it, we suture back to the remaining side of the defect. So this is called thinner flap. This is called pedicle flaps, we call in plastic surgery. So in this way, we reconstruct the fingertips.